Assalamu alaikum. Today the topic of my video lecture is the differences between dilated cardiomyopathy, abbreviated as DCM, hypertrophic obstructive cardiomyopathy, abbreviated as HCM or HOCM, and restrictive cardiomyopathy, abbreviated as RCM, on the basis of following features. The first one is primary problem. I'll basically use the abbreviations from now on. So, primary problem in DCM is systolic dysfunction, while in HCM and RCM it is diastolic dysfunction. Now, coming to the left ventricular size, which is dilated in DCM, while it is normal or small in HCM and it is normal in RCM. Now the wall thickness, which is normal or thin in DCM, markedly thickened or due to asymmetric septum in HCM and normal or mildly thick in RCM. Now coming to the ejection fraction, which is decreased in DCM, it is normal or mildly increased in HCM and it is normal in RCM. The compliance in DCM is increased, while in HCM it is decreased, and in RCM it is very much decreased. Now, the common causes of DCM are idiopathic, viral, alcohol, B1 deficiency, peripartum, Duchenne muscular dystrophy, sarcoidosis. Causes in HCM are genetic, mostly autosomal dominant. And the causes in RCM are autoimmune, including scleroderma, polymyositis, dermatomyositis. Infiltrative causes, including amyloidosis, sarcoidosis, hemochromatosis. Storage causes such as Gaucher's disease, Fabry's disease, Hurler's disease, and glycogen storage diseases. And endomyocardial causes, including endomyocardial fibrosis and radiation. Now, coming to the murmurs, the murmur found in DCM is pansystolic murmur of tricuspid regurgitation or mitral regurgitation, along with third heart sound, that is S3, and fourth heart sound, that is S4 gallop. The murmur in HCM is ejection systolic murmur due to left ventricular outflow tract obstruction and pansystolic murmur due to mitral regurgitation. While the murmur in RCM is absent, while S3 and S4 may be audible or may not be audible. Now coming to the epic speed, which is displaced and diffused in DCM. Epic speed in HCM is forceful and double impulse, while the epic speed in RCM is located at its normal position, that is fifth intercostal space. Now coming to the chest X-ray, the findings of DCM in chest X-ray are that we see cardiomegaly, while the chest X-ray in HCM is normal, and in chest X-ray of RCM we see normal ventricular chamber size but atria are enlarged. Why is chest X-ray done in RCM? It is just done to see if calcifications are present, which is positive for constrictive pericarditis. Let's discuss the differences in pulse of all three. The pulse in DCM is dicrotic pulse, while pulse in HCM is jerky carotid pulse, which is known as pulsus bisfreans, and the pulse in RCM is a weak pulse. Now, let's see the key complications. The complication in DCM is heart failure and thromboembolism. The complication in HCM is sudden cardiac death, and HCM is the most common cause of sudden cardiac death in young athletes, while the complication in RCM is severe diastolic heart failure, in which the right-sided heart failure is greater than the left-sided heart failure. Thank you so much. This was all for the differences between DCM, HCM, and RCM on the basis of all of the following features. If you want to study each topic individually, I have already uploaded the video on each one on my channel. Thank you.